Well, rural and regional Victorians don't enjoy great healthcare. Generally speaking, the life expectancy in rural Victoria is slightly less than metropolitan Victoria. Why is that? Access to healthcare is a big issue. 2021, Ballarat Hospital, Stawell, Horsham, Edenhope and Imbula hospitals came together to form Grampians Health with the goal to bringing health outcomes to regional Victorians in a way that we couldn't possibly do individually.
We undertook an amalgamation in which brought with it challenges and opportunities. And one of the challenges through that is that we weren't able to connect. And in healthcare, connecting is really important, both with our patients and also with each other.
So Grampians Health engaged MBS's consulting services to support them on this project, and that's largely because the work required was broader than just a leadership program. Learning and development has been identified as a crucial aspect to their success and the success of their leaders.
Well, the amalgamation generated a really strong opportunity for us to develop our new culture, and so bringing together our Melbourne Business School to lead a project in that regard enabled us to get the fundamentals of where our building blocks were and give us a very clear pathway on the work we needed to do to improve and change culture to give effect to our broader goals as a regional health provider.
Discovery for Culture projects typically follows a top-down approach, which is a diagnostic and assessment approach to understanding what culture looks like in an organisation. We've tackled it from the ground up intentionally on the assumption that culture is something that is happening around us and it's all the time and it's an evolving, moving beast. We've been able to uncover a lot of nuance in the system, a lot of nuance in terms of the messaging that's appropriate, the communication needs, and really importantly, the leadership needs for this particular project. So we're focusing on culture change rather than just getting a snapshot of culture at a point in time.
And that was really important because it gave us a lens into what's most important for us to develop within the leadership program.
We spent 3 weeks out on campuses, so Ballarat, Dimboola, Edenhope, Stawell and Horsham, meeting a lot of different people, getting to know the environment and some of the day-to-day operational challenges, observing the way that things work in the flow of work, and starting to make connections between the way that culture moved and the way that leadership was operating within that culture as well.
Well, Melbourne Business School have been a delight to work with. They have immersed themselves into our organisation. They've become trusted partners and trusted advisors. Working with Sean and Michael have been really challenging for us at time, and don't say that lightly, that what we didn't want as a partner is someone that's going to come in and just say everything's fine and tell us exactly what we want us to know. They've come in and given us some pretty strong feedback about the things that we can do better.
People really appreciated being able to have conversations about what worked well and what doesn't work well at Grampians Health. Certainly the positivity around the leadership program that we're currently piloting is for me one of our early successes.
That's really exciting, and it's such a rewarding space to be able to constantly test each other and put ideas on the table and then come up with a really tangible solution that's going to work for their needs.
I see people all the time who take a responsibility on their shoulders to do things that aren't within their immediate sphere of influence. Now, we've had some substantial challenges as an organisation, bushfires, floods, as such, and staff at all levels have stood up and have shown remarkable leadership in those circumstances to provide calm and reassuring care to our residents and our community.
Definitely tell other healthcare organisations and organisations across other industries to partner with us and come and speak to us about how we can work with you to really accelerate the goals and the strategy that you would like to see your workforce achieve.
And it's through partnerships such as Melbourne Business School that we will see a substantial stepwise change in the capability of our health leaders in Australia. I'm delighted to be involved, and I couldn't think of two greater partners in those two organisations.